In the battle for pain relief supremacy, two heavyweights take center stage, OxyContin and Neurontin. These pharmaceutical giants have been locked in a fierce competition, each claiming to be the ultimate solution for pain sufferers. But which one truly reigns supreme? OxyContin, a potent opioid painkiller, has long been hailed as a game-changer in pain management. With its time-release formulation, OxyContin promises prolonged relief for chronic pain conditions. Its effectiveness, however, comes at a cost. OxyContin is notorious for its highly addictive nature and the potential for abuse. On the other side of the ring, we have Neurontin, an anticonvulsant medication originally developed to treat epilepsy. However, it has gained popularity as an off-label treatment for various types of nerve pain. Unlike OxyContin, Neurontin is not classified as a controlled substance and is considered less addictive. In this matchup of pain relievers, we will explore the strengths and weaknesses of OxyContin and Neurontin. We'll delve into their mechanisms of action, potential side effects, and the medical conditions they are most commonly prescribed for. So, join us as we go deep into the ring to determine which contender deserves the title of pain relief champion. Understanding pain relief medications. Pain relief medications play a crucial role in managing various types of pain, from acute injuries to chronic conditions. It's important to understand the different classes of pain medications and how they work to alleviate pain. Opioids like OxyContin belong to a class of drugs that work by binding to opioid receptors in the brain and spinal cord, reducing the perception of pain. OxyContin contains oxycodone, a potent opioid that provides powerful pain relief. However, opioids also come with a range of side effects, including drowsiness, constipation, nausea, and the potential for addiction. Neurontin, on the other hand, falls into the category of anticonvulsant medications. It works by stabilizing overactive nerve cells, reducing abnormal electrical activity that can cause pain. Neurontin is primarily used to treat epilepsy but has gained recognition for its effectiveness in managing nerve pain associated with conditions such as diabetic neuropathy and postherpetic neuralgia. While both OxyContin and Neurontin can provide pain relief, they target different aspects of pain perception. OxyContin directly affects the brain's opioid receptors, while Neurontin acts on nerve cells to modulate pain signals. Understanding these mechanisms of action is essential in determining which medication may be more suitable for specific pain conditions. The battle between OxyContin and Neurontin. In the realm of pain relief, OxyContin and Neurontin have emerged as formidable contenders, each with its own set of advantages and disadvantages. Let's take a closer look at how these medications stack up against each other in terms of their effectiveness, side effects, and medical conditions they are commonly prescribed for. Comparing the effectiveness of OxyContin and Neurontin. OxyContin is renowned for its potent pain-relieving properties. Its time-release formulation allows for around-the-clock pain management, making it highly effective for chronic pain conditions. However, due to its classification as an opioid, OxyContin carries a significant risk of addiction and abuse. Patients who require long-term pain relief must weigh the benefits against the potential consequences of opioid dependence. Neurontin, on the other hand, has proven efficacy in managing nerve-related pain. Clinical trials have shown that Neurontin can provide significant relief for conditions such as diabetic neuropathy and postherpetic neuralgia. Additionally, Neurontin is not classified as a controlled substance, making it a safer option for individuals who may be prone to substance abuse or addiction. Side effects of OxyContin and Neurontin. As with any medication, OxyContin and Neurontin come with their own set of potential side effects. OxyContin, being an opioid, can cause drowsiness, constipation, nausea, and respiratory depression. The risk of addiction is a significant concern, especially when used long-term or in higher doses. The misuse of OxyContin has contributed to the opioid crisis in many countries. Neurontin, although generally well tolerated, can cause side effects such as dizziness, drowsiness, and weight gain. In rare cases, it may also lead to suicidal thoughts or behaviors. It's important for patients taking Neurontin to discuss any concerning symptoms with their healthcare provider to ensure appropriate management. Legal and ethical controversies surrounding OxyContin and Neurontin. The use of OxyContin has been mired in legal and ethical controversies. Its addictive nature and the rise in opioid-related deaths have led to lawsuits against the manufacturer, Purdue Pharma, and increased scrutiny from regulatory authorities. The marketing practices of Purdue Pharma, which downplayed the addictive potential of OxyContin, have been widely criticized. Neurontin has also faced its fair share of controversies. The manufacturer, Pfizer, has been accused of promoting off-label use of the drug for conditions not approved by regulatory agencies. While off-label use is sometimes necessary and legal, it's important for healthcare providers to carefully consider the risks and benefits before prescribing medications for unapproved indications. Choosing the right pain relief medication for you. When it comes to pain relief, there is no one-size-fits-all approach. The choice between OxyContin and Neurontin, or any other pain medication, depends on various factors, including the type and severity of pain, individual medical history, and potential risks and benefits. It's crucial to consult with a healthcare professional who can assess your specific needs and guide you towards the most appropriate treatment option. They will consider factors such as the underlying cause of your pain, your medical history, and any potential drug interactions or contraindications before making a recommendation. Alternative pain relief options to consider. In addition to medications like OxyContin and Neurontin, there are various alternative pain relief options that can complement or even replace pharmacological interventions. These may include physical therapy. Targeted exercises and techniques can help improve strength, flexibility, and range of motion, reducing pain and improving overall function. Acupuncture. This ancient Chinese practice involves the insertion of thin needles into specific points of the body to stimulate pain relief and promote healing. Mind-body techniques. Practices such as meditation, deep breathing exercises, and guided imagery can help manage pain by promoting relaxation and reducing stress. Herbal remedies. Some herbal supplements, such as turmeric, ginger, and devil's claw, have been traditionally used for pain relief. However, it's important to consult with a healthcare provider before trying any herbal remedies to ensure they are safe and effective for your specific condition. Consulting with a healthcare professional for pain management. Pain management is a complex field that requires individualized care and a multidisciplinary approach. While this video provides an overview of OxyContin and Neurontin, it's essential to consult with a healthcare professional before making any decisions regarding pain management. A healthcare provider can conduct a thorough evaluation, consider your medical history, and discuss the potential risks and benefits of various treatment options. They can help tailor a pain management plan that addresses your specific needs while minimizing the potential for side effects or complications. Conclusion. Weighing the pros and cons of OxyContin and Neurontin. In the battle for pain relief supremacy, OxyContin and Neurontin offer distinct advantages and disadvantages. OxyContin provides potent pain relief but comes with a higher risk of addiction and abuse. Neurontin, while less addictive, may not be as effective for certain types of pain. Ultimately, the choice between OxyContin and Neurontin, or any other pain relief medication, should be made in consultation with a healthcare professional who can consider your unique circumstances and guide you towards the most appropriate treatment option. Pain management is a complex journey, and finding the right balance between pain relief and avoiding potential harm is of utmost importance.